Magwitch. Oh, I got a big recording box. Magwitch, thank you so much, Karen. Good afternoon, everyone. I'll begin by introducing myself. Ani Buzu, Tase Dopawiya Indigenakas, Mayagando Dam, and my English name is Jodie Millward. Thank you for the introduction, Karen. I am, as Karen mentioned, I'm with the First Nations Health Authority as well. I am the Director of Health Emergency Management. And under our portfolio under public health, I help support and hold up the response to the toxic drug emergency. So I have the honor of supporting our toxic drug response team. And that's going to be the focus of our conversation today. So I just wanted to take a moment to do a few things. I want to acknowledge that I typically reside on the traditional territory of Tuatha First Nations in Stalo Nation territory. But today I have the honor of calling it the Soyuz Indian Band territory, the Silk Nation traditional territory. And so I am in a hotel room, so if things get a little chaotic, we're gonna deal with that because I'm in a little bit of a new environment. And I also want to just acknowledge that this conversation today can be a hard one to have. There's going to, I'm going to try to provide information and as well as have the opportunity for questions and see what we can do to, I'll take notes and anything that I need to take away, I'll make sure that I do that and bring things back to you. I'm also hoping, I put some resources together to send out afterwards, but I'm hoping that after this conversation, I'll get a sense of what it is that you're looking for. And so after the presentation, I can send out a more fulsome resource package for you. So please don't be shy. If there's something you want to know more about or something that we don't have time to touch on, please let me know. I will be sharing my screen, so I may not be able to see everybody's hands, but Karen promised that she'd let me know if there's a question. So is there anything that anybody would like to share or say before I get started today? Finding that mute button can be a challenge, so I'm just going to create a little bit of space. Okay, great. I will share my screen and we'll begin our chat together today. I am, and I can see if a hand goes up. So just wanted to give a little bit of background around the toxic drug emergency. Some people may have noticed a shift in language that happened. So it's been 6 years since BC has declared a public health emergency around the toxic drugs that are not just in BC, but across the world. We have seen an increasing amount of lives lost due to toxic drugs. When the crisis was first declared, it was actually called the opioid overdose. So you may know that language. About 2 years ago, they started to shift the language around response to better reflect what the emergency is. So as we've been moving through the emergency for the last 6 years, we really come to understand better what it is that we're facing and what it is that the challenges are. And that, yes, it is because of fentanyl and drugs, and but it's really about the unexpected toxic drugs that are out there. So it's not that we're seeing an increase in the amount of people who use substances, and it's not that we're seeing an increase in the amount of drugs that are in communities or in our families. It's that we're seeing an unexpected substance in those drugs, which are causing overdoses and death. So we've shifted the language to better reflect what the emergency is, which is the toxic drugs that are in our communities and that our family members and friends and loved ones that are using. One of the other things that we've learned is that First Nations people are disproportionately impacted by the toxic drug emergency. And there are stats and things that we can go through. I didn't want to focus on that today, but I will show you where on our website you can find that information if that's something that you want to know more about your area or your nation or different parts of the province. And the other thing that we've discovered in the last 2 years of this emergency is that the COVID-19 pandemic has compounded the risks and the harms for people who use substances. We saw a dramatic increase in the amount of people who've experienced overdoses or lives lost during the pandemic for a variety of reasons, like having to close services down, people being isolated in their homes, and lots of the measures that we were putting in place to better support people, we couldn't do during the pandemic. And so we did see an increase in the amount of events happening. So I did put this slide in. This is the most recent information that we've received from our data surveillance team. I wanted to share some high-level information. I know that we have people here from all over the province, so I wanted to try to put something that would be relevant for all of us in some way. So this is gives you an idea of how things have been progressing in the different regions over the years. And the first box is actually a reflection of the whole province altogether. So I didn't want to focus too much on this today because this is and so but I do know that this is part of our conversation, and this is why we're showing up, and this is why we're all in this space together. So it's not that I didn't want to bring it into the conversation, but I didn't want it to be the focus of our conversation today. There is on our website, which I'll show a little bit later, there is a place where you can find the sit reps. So we try to put out the monthly sit reps that provide this kind of statistics and data that touch on the amount of incidences that are happening as well as lives lost. And I just really want to acknowledge that every single number on the screen is a person, is somebody that we love and that we know. And really want to honor their lives. The coroner's report is from the province, and it's a reflection of mainstream as well as incorporating First Nations. So it's kind of everybody. I just wanted to say that so that we know that we weren't focusing just on our specific First Nations lives. But the coroner's report that was released in July 2022 has some really interesting pieces that have helped us, and we use the coroner's report to help us figure out what we can do in the response. And some of the interesting pieces to this is that 84% of the toxic drugs that occurred in 2020 so far actually occurred inside. So I know that a lot of people are thinking that it's, people that are living at risk, that are homeless or near homeless, or people who are not using in their homes, but a significant amount of lives lost happened in people's homes. And so that tells us that we need to start to shift our response and how we respond and how we're supporting people. So we actually use these kinds of information to help us figure out how we support people. The other significant information that comes out of the coroner's report is that the majority of the people work in the trades as well. So as operators or as construction workers and in various other trades. So we see a significant number of people who work in the trades. And that 71% of the people are between the ages of 30 and 59. So are we reaching the right people with the programs and services that we're offering, or with the education? Those are the kinds of questions that we can ask ourselves with brief information from the coroner's reports. And those are available online as well. So everybody has access to this information monthly as it comes out. I wanted to share this slide because FNHA has created a very specific team in order to respond to the toxic drug emergency. And we thought that was pretty significant because we do have amazing team members who work in the mental health and wellness field, who work in, addictions and trauma, addressing trauma, treatment centers and detox solutions, like, so many amazing people that are focusing on this whole spectrum of response to support people who use substances. And so this diagram was created to show that there's actually a whole spectrum of programs and services and people who focus in different areas in order to support somebody who uses drugs and is at risk of an overdose. And so our toxic drug response team actually sits in the harm reduction section. This is where we focus. And the way that we're seeing our role in this response is that in order to follow this journey, in order to engage in programs, treatment centers, detox, all of those things, in order for somebody who's using substances to embark on that healing journey, we actually have to keep them alive long enough to get that journey, to be on that journey and to work their way through that journey. So the toxic drug response team focuses on keeping people alive. That is our primary piece. And then we do that mostly by harm reduction and supporting people where they're at. So if people are still in the stage of their journey where they're still using substances despite the risk, we want to make sure that we're providing enough options for them that they stay alive and that we reduce the harms done to them while they're using substances so that they can make the decisions as we go. And that's why we really think that harm reduction is our focus. And we created the harm reduction policy. If you haven't had a chance to read that, it's on our FNHA website again. And it's a policy designed, it's an external facing policy, although it is internally for FNHA, but it's designed to really support and hold up people who use drugs in advocating for themselves and their safety and their wellness. And it helps lead our organization in our response and how we can focus here on the keeping people alive, while other parts of the organization focus on the getting people through the healing journey. So they're all important and they all interact with each other. But for this conversation today and for my time with you, I'm talking about like what we're doing to address the specific issue of the toxic drugs. And it's not easy to separate those out, but just to give you context, I would also really like to acknowledge that by no means do we know that, or do we think that what we're doing is enough already. We always know that we need to be doing more and that we need to be doing different things, that we're not reaching everybody in the way that we hope to yet. And this is a continuous process. We're continuously evaluating and looking at and seeing what could be done and what could be different. And how we can continue to work with those other teams that are doing the whole spectrum of response so that we're not in isolation or siloed, but working all together. This is our framework for action. So this was initiated and created in the beginning of the emergency. And this is what's been guiding our response since the beginning. And so preventing people who overdose from dying and keep people safe when using substances has been our two primary pieces under the public health response team. And then we have other teams that have been focusing on creating an accessible range of treatment options and supporting people on their healing's journey. And it was really important for us to have these four pillars because we have a history as service providers, we have a history of being siloed. We're just putting our heads down and just doing what we need to do in our own little world. And we can't do that with this emergency. We absolutely need to be working with our partners. We absolutely need to have everybody coming to the table. And it's not just an FNHA challenge. We need family members, we need communities, we need our federal and our provincial partners. We need our health authorities. We need our service providers. And honestly, we need the people who are using drugs to come to the table and help us help them. So this response really can't be siloed. If we want to make an impact, we have to be in this together. And I will be in that resource package that I told you about. I will be putting links to both this spectrum document, as well as our framework for action and our harm reduction policy. So if you want to know more about those, I can definitely support in getting you to those places. I did want to talk about some of our response initiatives, because I think awareness and education are the #1 pieces of what FNHA can help support you who are in community and supporting your families and your members. So I wanted to touch on our virtual substance use and psychiatry service, because they provide assessments and referrals. They can do withdrawal management guidance, as well as help people get on OAT, which is opioid agonist therapy, which helps provide medication for those who are coming off of an opioid. So they're a service, and so they're accessible actually through the doctor of the day. So if somebody calls the doctor of the day line and indicates that they they would like some support with their substance use, they'll get sent to the virtual substance use and psychiatry service, which we affectionately call VSUPS for short. Excuse me. We've also helped support our regional teams. So as we know, our regional teams are like the first line of connection for communities that are trying to access FNHA and FNHA services. And so we've funded some positions to help ensure that they have the resources they have in order to support you, to support your communities. So many of the regional teams have an addiction specialist that's been on the team for a while. So we funded a second position to focus specifically on the toxic drug emergency, recognizing that if there's only one addiction specialist in the region, then they're not looking at the whole picture because they don't have the capacity to do that. So that being able to specialize and focus specifically on the toxic drug emergency, as well as the harm reduction educators. Hopefully you've had the opportunity to meet some of our harm reduction educators. They've been doing a lot of training on naloxone, or not just naloxone training. Some have been able to support around peer networking, which we're going to talk a little bit about later. So education around harm reduction, using naloxone, harm reduction supplies and services, where peer networking has been the majority of their focus. We've also been able to fund 3 peer coordinators in each region, and that looks different in every region. But to better be able to hear the voices of the people who are using drugs in order to ensure that what we're doing is meeting their needs, and that the things that are being discussed and implemented are actually things that they need, because that's where we need to see the impact. As well as child and youth care community coordinators have been funded in every region, and they specifically focus on youth engagement. We also have our Indigenous Harm Reduction Community and Council, and it's a BC-wide network that has had to take a little bit of a break because during COVID, things got a little bit heavy and there was a lot. And of course, we can only move as fast as what our peers and our people who sit on the committee can do. So they did have to slow down and take some time. They are picking back up, and we hope to have that committee and that council back up and supporting our work in a good way as soon as possible. We also have the Reduction Hub, which is an email address that's available to each and every one of you to reach out to, and it's how you would access our bulk nasal naloxone supply. So for communities that would like access to nasal naloxone, on top of the injectable naloxone, which is available. If you as a community would like to register as a site to receive harm reduction supplies, they can support with that. So the harm reduction hub was really established in order to be a one-stop shop to have conversations around harm reduction supplies, services, approaches. If you're looking for support on like what we're doing isn't quite working or it's not meeting enough needs, that's the great place to begin a conversation and pull in all the other people that could be of service. So maybe the regional teams or our team, the Four Directions team. So it was really designed to be an easy one access point. We've also been, I think it's our second or third year, sorry, I don't remember exactly, but using our grants for International Overdose Awareness Day, which is at the end of August. And this year's suggested theme, it was to support around grief and loss over the lives lost and how communities are carrying that. And so those grants are a relatively an annual thing, and they're meant to really focus around one specific event or community gathering or ceremony or education session or whatever it is that's needed. And then the last point on the line is engaging with communities to access need for pharmaceutical alternatives to the poison drugs, which for short we're calling safer supply. So you've heard those conversations. And some of those conversations you might have had with our Four Directions team who take a lead in this as our clinical experts, and they focus on the OAT therapy and getting access to OAT into First Nations communities, as well as nurse prescribing and other options that might be available. So again, just by calling that harm reduction hub, you can begin those conversations to see if there's an option for your community. Some of you may have heard that FNHDA has moved into a level 2 emergency response. And it's not necessarily clear what that means to a lot of people. So I thought I'd just touch on it. But FNHDA has an internal policy around emergency management and emergency and disaster management. And as part of that, we have a leveled response. And so by FNHDA moving into a level 2, it allows us internally to shift priorities to support those who are focusing on the toxic drug emergency. And that's probably the biggest outcome of moving into a level 2 emergency. So if our regional teams are struggling with capacity or not being able to support in the way that you guys need them to, then we can realign some services internally and help. We can reassign team members and all of those. So that's probably the most significant piece of FNHDA moving into a level 2 emergency response. It allows us to really, really recognize that this is an emergency. It needs to be taken seriously. And it also helps show our partners that we expect the same from them. And that's another big outcome of declaring a level 2 emergency response. Our CEO has offered FNHDA support to host community or nation or family group workouts to identify gaps and enhance planning around the toxic drug emergency. So we're, if there's an opportunity or if there's any way that FNHDA could help support a conversation, we want to be a part of that, and we want to help hold up and help communities or nations or regions do the work that needs to be done in the way that you're ready to do it. Has been a commitment done by our CEO. We also are ensuring that we're enhancing the harm reduction education, stigma reduction, ensuring that people who don't need to know how to use naloxone, either injectable or the nasal naloxone, they know how to do that, and they know how to do it confidently. And and that they also have the supplies that they need, which is the other piece. There is some work being done around treatment beds and detox. That is another team, so I can't speak to that all directly. I will do my best to make sure I can take any questions back, though, like I mentioned. And then, as always, we're working with our partners to identify opportunities and funds in order to advance our response in response to the needs on the ground. So that's something that we do on an ongoing basis with our partners. Part of the emergency response to this has been this feeling that's when we're on the ground and we're sitting in it, what is it that some of the things that we could do? So some of the initiatives I told you are like really high level, and they're like things that, we're doing at policy levels or at strategic planning tables, and all of those are really important and should be happening. But how are we supporting people in community? How are we supporting people who are using drugs to stay alive? And so I wanted to give you some examples of some things that communities or regions have been doing in order to make that impact for those directly and in more real time. And so some of the examples are peer networks. And I did mention this earlier, and I was hoping that Berkeley Baker, who's our peer coordinator on our team, could join us, but she is sitting with some peers and doing really important work. So I told her I'd do my best to share. But peer network is one of the most successful pieces of the response so far. And it allows one of two things. It allows communication from peers to the people that are doing the planning and asking for programs or services or developing the response. And that's really important for us to hear. But it also allows for communication the other way as well. So if it's discovered that somebody has brought toxic drugs into a community and that they've all been distributed in the community and we don't know who they've been distributed to, that informal peer network is going to, be something that you could use to get the word out that there's toxic drugs in the community. Make sure you follow your safety plans. Make sure that you don't use alone. Make sure you have naloxone and all of those things. It allows for a response to happen on the ground for those who are most at risk of the toxic drugs in the community. So, having those connections and those informal relationships or formal relationships have been a huge part of our response so far. Drug alerts are another big piece, which is using social media, using Facebook, Twitter, emails, text messages, all of those things through your networks. We've also found that communities using their social media page, if there's a page that people in your community are already using to see alerts or to get information, that's been the absolute best way, instead of FNHDA putting it out alone, which we always do on our networks. But if there's people who are already using yours, then we highly recommend using that system as well. And it's this idea that you can never have too much information out there. If there is the potential for toxic drugs in a community or an area, and you have that information about, like, I should have brought an example of a drug alert, but usually it's a color, or if you know what it was that the person thought they were buying, it's on there, what the outcomes were, what the symptoms were that people should watch for, and then making sure that you're reminding people to follow their safety plan. One of the other points is about providing harm reduction supplies in community has been tremendously helpful, because it gets directly to the family members and the people that need it. Also, just want to draw attention to the fact that there is a group of people who are using drugs but don't see themselves as drug users. And so they're very at risk because they're not listening to the messages. They're not accessing any of the programs because themselves as somebody who uses drugs. So, but they are at risk if they even do it recreationally, or if they do it for pain management, or all those other things. So for people who don't see themselves as drug users but do use drugs, they're not hearing the messages that we have to say, because we're not talking in a way that they're listening. So that's been a really big learning for us. As well as naloxone training, making sure that we know how to use both the injectable and the nasal naloxone. The injectable naloxone being the most effective, of course. So we encourage communities to have access to both. And then there has been examples too of communities setting up episodic overdose prevention site. So if there's been toxic drugs found in a community with several near overdoses, setting up a site where people can come and use without judgment, just being monitored so that they can make sure that they're safe. And then once they're safe and they're okay, then they can go back to their home or wherever it is they're on their way to. It's been a very innovative process. And I figured by this point, I will have been talking a lot. So I wanted to actually just create a space here and see if there's any examples or anything that anybody would like to share at this point. I'm going to drink water while you think about it. Very quiet. If you do have an example from your community or something that you've heard of another community doing that you'd like to share, I'd absolutely love to hear it, because the more information we can share amongst ourselves, the better we all are. We need to learn from each other. I'll just finish up the presentation and then we'll create some space for conversation or questions. I did talk about through most of these already. The harm reduction hub, which we talked about. One of the things I did not mention earlier is that you can order also drug testing strips and other harm reduction supplies. So it's not just nasal naloxone, but it's an opportunity to access a variety of harm reduction supplies. I did talk about the 4 Directions team and how they can support around getting OAT therapy into the community or nurse prescribing, not just naloxone training. We do have grants. I mentioned the International Overdose Awareness Day grants, which are usually opened towards the end of July and for the end of August. But we are also looking at the last year we were able to offer the harm reduction grants as well, which were significantly larger. So and those came out in January. And so it was an opportunity to try to pilot or create new programs or continue programs or build up existing programs using the harm reduction grants. We are hoping to be able to do that again. There's also the Courageous Conversations with Karina Chase from our OCMO office, our Office of the Chief Medical Officer office. Yeah, that's right. And she can help have some of those conversations between peers and people who use substances, as well as professionals or family members in a community, to really talk about courageous conversations to get through the stigma and the judgment and all of those pieces. One of the things that we know for sure is that the opposite of addiction is not abstinence, it's actually connection. And it's isolation that is what kills people. So ultimately, because if there's somebody around, people's lives are typically saved. So connection and having those conversations, reducing stigma, making it a safe place for people who use drugs to come forward and seek help and get the support that they need is one of our biggest goals. We did talk about Doctor of the Day and the virtual substance use and psychiatry services. The situation report, I'm going to walk through one of those. I'll show you where those are on the website, and we do post those monthly, as well as the public source of information on our website. So I think on the next slide, I'll flip over to our website so you can see it. And I did walk through our regional teams for you. So this is what our website looks like. I am going to stop sharing my screen and then share so that we can go through the website together. But there's the website there. I'm going to jump over to that. Give me 1 second. Oh, I get to see people. Hi, Rhonda. Sorry, I didn't mean to call you out in the middle. Couldn't see anybody. Okay, let's share my other screen here. Awesome. So this is our website. And so a lot of the feedback that I get is that this website is very, very busy and it is very, very full. And so I wanted to take the opportunity to just spend a few minutes on it to help make it a little less scary and a little bit more useful for those who might want to use it. So this is the main page. And what we've tried to do is break it down into 4 sections. So if you're looking for information, you can just click on the Get Informed box. And here is where you'll get a lot of our information pages, our resources, fact sheets, the news stories, that framework that I walked through, that's on here. And this is where you're going to find our infographics. So if you've had the opportunity to see the infographics, both the regional and the provincial one, that provide the most up-to-date information on the amount of incidences and overdose deaths that have occurred, this is where you're going to find those. So if you come to this page and you're looking for information, you can click on the Get Informed box and it'll take you to the resource pages. If you're looking for help and support, either for yourself or for a loved one or a community member, and these videos are amazing. I love them. But this is where you're going to find information on our VSAPs and our harm reduction services. If you're looking for an overdose prevention site in your area, this is where you're going to find that information. So we tried to break it down in a way where it's like, okay, I'm looking for information. Go here. I'm looking for help. This is where I need to go. It also provides information on some of our partners and the work they're doing, such as the Lifeguard app, which is an app that people can download on their phones. And if they don't have anybody that they can call to use safely with, they can use this app instead. And so they go to use drugs, they let the app know they're going to use, and if they don't answer and push that button again within a certain amount of time, the app automatically calls for help. So, saving lives if people aren't using alone. As well as some of our most trustworthy websites. Towards the Heart is like one of our #1 websites that we recommend as a resource. Always current, always correct information, as well as driven by people who use drugs. So it's for people, by the people that they're servicing. So this is where you get information about services and programs to get help. So get informed and then support others. Wonderful, Lynn. A lot of this is about the harm reduction approach. Our Raven's Eye sites, if you are interested, if you think you have a need in your community to set up a safe using space, either an episodic overdose prevention site or a fixed overdose prevention site, this is a guide that can help walk you through that process. The All Paths Lead to Wellness, that spectrum picture I shared earlier, this is where this diagram is. So all of these pieces around how to learn about harm reduction, how to implement harm reduction, how to bring it closer to home into your communities. This is where you're going to find that information. And again, this is focusing on the toxic drug emergency as keeping people alive and that harm reduction bubble of that spectrum. And then the last box is the treatment centers, because we know that treatment is a very important piece of this journey. And so this is where you'd find those connection pieces around the First Nation specific treatment centers. And so we tried to make the website just a little less scary and a little less so much information. But you know, the reality is that if you're looking for something and you can't find it, I suggest you reach out to the Harm Reduction Hub or to your regional contact and just ask, because we likely have it and it's likely just in one of those many pieces of information, and you don't have to look for it on your own. We're here to support, and we spend a great deal of time on this website and in those resources. So, you know, we are definitely here to support you and make sure that you have what you need. And then opened up and released recently is a website dedicated to okay, my computer.
I think you frozen, Jodie.
All right, I was wondering. Am I back now?
Kind of.
So Judy, what I would do is maybe shut your video off. We do find sometimes that the audio is better or stronger. Not that we don't want to see your beautiful face.
Did I make it back?
You did.
Wow. Okay. So this was that I'm in a hotel room that I shared right at the beginning, and the internet is a little spotty. So I hope you had very fascinating conversation while I was gone. Just pull this back up.
You weren't gone for long, so it's all good.
Wasn't sure where I left off. So I'm just going to start back off at this screen, if that's okay. Perfect.
Yeah, that's good.
Awesome. So very recently we made live remembering and honoring our lost loved ones that we've lost to the toxic drug crisis. I think in this emergency, we don't want to forget that, yes, there are people who use drugs, they're at risk, their lives are at risk, and that we're doing everything we can to try to keep them safe. But that there's a lot of families and communities and friends that are struggling with the amount of people that we've lost, and for a variety of reasons. But, you know, in this situation, we're talking specifically about the toxic drug crisis. And so we've made this website honoring our lost loved ones at f.fnha.ca, where family members or friends can go and just be with other people who are experiencing the same loss. And we can share stories. There's an opportunity to share a story of somebody you may be missing. You can do it by video, or you can do it by written and share a picture. But the idea is that there's a lot of grief and loss. We need to be able to talk about it. We need to know we're not alone. And because this work is hard, we can't let it stop us. And so we created this opportunity to share. We also really want to acknowledge that the people that we've lost to this emergency were more than their drug use. They are have whole stories and whole lives and are whole people. And we really want to use our traditional ways of storytelling to really honor and hold pulled those stories up, we pulled those people up, and all of who they were. So it just became live not that long ago. So it's working its way out there. Feel free to share this. I will put it in the resource package. But if you want to take some time to go and check out the site, or share a story, or just listen to other people's story, we're hoping that it's just a space that we create that's a safe space to sit in ceremony, sit with others, get resources, as well as share stories. And then I think this is last but not least, I wanted to touch on the decriminalization. I know that this is a pretty big piece of information that's been coming out. So just as an overview of it, on May 31st, Health Canada approved BC's request for decriminalization of opioids, cocaine, MDMA, and methamphetamine. And so these 4 drugs, if anybody who's caught carrying less than 2.5 grams of all of these together, so not just 2.5 grams of each, but total, they can't be arrested, and they can't be, they won't be arrested. Sorry, it's not that they can't, it's that they won't be arrested for carrying drugs, and that they'll have an opportunity to be connected with resources and services instead of being arrested and getting a criminal record. Some of the questions that I've had are like, how much is 2.5 grams? It really depends on the drug and like which form it's in and stuff like that, but it's about the size of a tablespoon or less. So it's, just as an idea. Also really want to say that this is not legalization. It's not that they're making these drugs legal. It's that they are trying to reduce the amount of harms done for those people who are caught carrying small amounts. This only applies to people 18 years and older. And at this point, the province is still having to uphold their mandate to consult and engage with First Nations communities on decriminalization. So if you're sitting there thinking, I haven't been engaged or consulted on this, the ministry has that mandate and they will be doing that. Actually, I think I heard yesterday, like hot off the press information, that those engagement sessions are going to be done at the end of November, beginning of December. So if you're interested in being part of those conversations, please keep an eye out for that invite. This was done by the ministry, so FNHA is not implementing decriminalization. That's not our role. We're not, part of any of those pieces. This is all done by the province as part of a greater response. So, oh, right. Oh, sorry, I'll just finish this one piece first. Decriminalization is not legalization. So trafficking of drugs is still going to be illegal. Selling of drugs is still illegal. Manufacturing drugs still illegal. None of those things have changed. The biggest point around the carrying of up to 2.5 grams is to, one, create a safe place for people to carry drugs if they want to go to an overdose prevention site, or if they want to go somewhere else so that they don't have to use alone. They don't want the fear of being caught with that kind of drugs and the criminal record that'll come with it, as well as all the other pieces that come from needing substances and the criminalization that comes from it. So we're very aware that decriminalization alone will not prevent the toxic drug poisoning deaths, that this isn't in itself, but it's part of a larger response. And it really helps shift the conversation from criminalizing or punishing people to supporting and providing resources for people. It creates a safer place for people to want to go to the hospital if they need to. Because some people are saying, I can't go to the hospital, I have drugs on me, and they'll take it and I'll get a criminal record. So like, it just creates this safer place where we can focus less on, oh, you're carrying drugs as a conversation, and more about, okay, so drugs are part of your life. How can we help keep you safe and help you get on the healing journey that you're looking for? So that's like kind of the biggest role of what decriminalization will play in the greater toxic drug response piece. More information will come out once the ministry starts to do their engagement. So I really encourage, like, if this is an area you want to know more about and what this means for your community and your families, I encourage you to be part of those conversations once that's released, which should be very soon. And then for those who may not know, I'm assuming that most of you know your regional contacts, but around the toxic drug emergency, these are your primary contacts in your regional teams. And that was the end of my presentation. I had more to say than I thought I did. All right. I'm going to take this down. I'll make sure to include those in the package that I'm sending out. That was a lot of information, really, really fast. Are there any questions or comments or feedback?
I just want to say thank you so much, Jodie, for doing this presentation. I only got part of it, so I look forward to the package that you'll be sending out. And I know you're so close by that if I have any questions, and I can either reach you by phone or email. Again, it's so good to see you and hear you.
Feelings mutual, Rhonda. Thank you.
Hi, Jodie. It's Jessica, Leewat Nation, Leewat Health and Healing Health Director. I have to be honest here. My expertise area isn't really in harm reduction, and you know, it's kind of scary, but also comforting as well to know that there's this much support out there for regarding this toxic drug. What do we call it? Pandemic. And you know, I've been hearing a lot about it and trying to learn about it in a quick time frame, but it is so much information, and you know, the amount of support out there, as well as, you know, I don't want to, you know, trigger something that's really serious, but you know, I want to knock on wood and say, you know, I'm not even familiar with overdoses in our community or even in our area, to be honest. And I knock on wood because I don't want to trigger it and have something major happen. I'm always cautious of that, and I want to mention that. But you know, I'm trying to think of what is the best way to start with our community, because our community is quite, I want to say it's the second largest First Nations. We have at least 2,200 on reserve here, which is other First Nations and non-First Nations located in our community. And so I'm not even aware of, you know, if there's any drugs in our community or not, because I haven't really heard of it being such a huge concern. But, you know, I've been hearing that there is drugs in our community, which, you know, the strongest drug I know that is here is marijuana. And I haven't heard others, but I'm trying to learn fast so that I can make sure that we're doing a lot of prevention work rather than, you know, our youth or adults passing away due to overdose. And so we did a small project in the past about, you know, the stigmatism about drugs and alcohol and harm reduction. And so that was a small piece that we worked on during the pandemic, because there wasn't really much that we can offer in our community when it came to the pandemic and trying to educate people without bringing people together. And so it's I just want to be honest that this is the area I want to be. Prevention, mainly education, stigmatism, And we've only provided like in naloxone training for staff. And so now we want to look at expanding that to other departments or even to community as well. So, I don't even know where to start or what to do, or not that I have a gazillion hours to work on a project like this, but I do have a wellness counseling department that maybe can help me in some areas, but I just wanted to mention those pieces. Thank you.
Thank you, Jessica. I think that's one of the hardest pieces for, so like I'm an expert in this, like I actually went to school for this, I do this for a living before I came to FNHA, like I spent a lot of time in this. So if it seems like I'm talking really confidently and knowledgeably, it's because this is where my jam is, right? And it's not super fair that, somebody who's like, actually, I don't even know what all those acronyms mean. And I can't talk confidently. Like, I don't know if I know all the ins and outs to harm reduction, and to know that lives almost depend on it, but you're not super knowledgeable in it. Like, that is not fair. That is not fair. I'm just going to put that on the table. I don't know how to address it, but it's not fair. And I think that I really like put my hands up to you for trying and like learning about it and bringing people in and doing the education. That is the beginning, is having the conversations, like just, bringing people in to talk about it, do education about it, getting it massaged in so people become more comfortable hearing about it. They recognize it. I really do encourage the not just naloxone training, either through your regional health, your regional partners, or the 4 Directions team. Both teams can do it if one's busy. But that training that doesn't just talk about naloxone, but also talks about like harm reduction and how harm reduction is actually a reflection of our Indigenous values. Meeting people where they're at and loving people and wrapping around them and wanting to keep them alive is part of like how we form our communities. So this should feel really natural once we get past that awkward piece. Right. I really do encourage those kinds of conversations, and that pulling in somebody from your regional team to help out these conversations. They will be your experts, right? They'll be your people that can help, so you don't have to be, and can help you figure out all the pieces that you don't necessarily know. Thank you for sharing.
What is the requirements for nurse prescription support? Like, is there special training for that piece, or?
Yeah, there is. So our 4 Directions team is, and I'll put information in that on the resource package too. It's going to be a lot of information, which you just said is much, but you know what? I'm just going to be part of the problem, not solution. So yes, there's whole training that nurses can take in order to be able to prescribe a safer supply of prescriptions, so that people who don't want to use the toxic drug supply, or want to start reducing their dependence, or using the oat therapy or any of those pieces, so that nurses in the area can actually be part of that and they didn't have to go through doctors. Yeah. That's about as much as I know right there, because I'm not the nurse who does that.
And then for the, you mentioned the psychiatry of the day. Who can do referrals for that? Is it any health director, or does it have to be a health professional like the doctor of the day, or?
It's got to go through doctor of the day. So the person has to call the doctor of the day line, and through there indicate that they like a connection for their substance use or their mental health. The psychiatry services are there too, right? So that's all through the doctor of the day. It's like an expanded version, or it's an expanded extension of the doctor of the day.
What did OAT stand for again?
Opioid agonist therapy. So it's a form of treatment. So if somebody is taking, let's say, heroin, and they want to stop taking heroin, they can be prescribed other prescriptions so that they can start either reducing their dependence on or use a safer supply of. And we can use OAT not just for opioids. There are people who use the OAT clinic for safer supply of cocaine or meth. We've seen a variety of things come through. Very medical. I have a one-pager on it. I'll put that in.
Sure. Where can we find like the nearest where people can get the testing strips for or naloxone kits? What else?
There's two things on that one. So the Towards the Heart website that I talked about, it has a link on there that you can click on to find the closest dispensing place to you. So the closest registered site that you can get services and supports at. But on top of that, you can actually get naloxone and testing strips sent directly to your community from our harm reduction hub. And they'll mail it out, and so that you can have the supplies and services you need, as well as provide the education on how to use those.
Who can dispense like the testing strips and naloxone? Do we have to have a specialized individual or just have on hand for availability, like our rapid tests for COVID?
That is a fantastic analogy. That's really so the only thing about both the injectable and the nasal naloxone is that the person who's receiving it should have training on it. Like they should be knowledgeable and experienced and know what they're doing so that they want to use it when they need to. So, but once somebody has training, so like if you had training for like 5 of your staff, any of those staff could distribute them and make sure that the person has the training, and they can do it really quick themselves. If the person, let's say there's an auntie who says, my nephew's coming to stay with me, I'd really like a naloxone in the house. I didn't do the training. That person could do the training really quick with them and help teach them what they know and those pieces. Same with the drug testing strips. So if you had a little mini training session with your staff, they can distribute that and provide the quick little training on how to do it and how to look for the results and what it means when you have the results and all of that. Yeah. Fantastic question.
When I was working in community, I took the naloxone training, and we ran a few like where we just would have at the health center and just sort of no judgment, open to whoever. And people would be able to take kits home with them. But then also once you've taken the training through the Toward the Heart, you can, and this was, I mean, it doesn't feel like it was that long ago, but things move fast. But so there's probably other avenues, but I could just order more supplies whenever. So I just literally had a cupboard in my office that I just kept stocked with the kits and the naloxone vials and all of that stuff just there for whoever needed to come and get more whenever they needed it. So they make it really easy.
And there are lots of like different ways to do this. Like if you have a needle disposal box in your community that you put in because you don't want them laying around, and so you've done that, you can put another little box on top of that you can put naloxone kits in. So if people are coming to dispose of their needles and they need a new naloxone kit, they can grab one while they're there, right? Like there's really, it's all about making it accessible and just, getting it where it needs to be. Yeah. It's such a hard conversation.
Thanks, Jodie. You answered a lot of my questions.
I'm glad. I'm glad. This can sometimes be an easier conversation one-on-one too. So that is always available. So if you have a relationship with either your harm reduction educators or your addiction specialist or your manager of mental health and wellness on your regional team, I encourage you to just try to set up a conversation. Like, can we just talk about this and figure out what next steps look like for us in our community and our families? And if for whatever reason that's not working out, or they don't have the capacity or whatever, because I know some of our regional teams are a little bit short, my team can support, I can support. Like, this is the Harm Reduction Hub can support. This is what we're here for, right? Like, we can't all be experts in everything. So let us support you. Let us walk you through this, the options, what you can do, what will work. There is not one solution that'll work for everybody. And I think that's the biggest takeaway from this, is that people who use drugs are like so vast. It goes from like once a year to daily or several times a day in use, right? And everything along that spectrum. And every single one of those people are at risk, because it's not about how often you use or how much you use. It's about what they're using is poisoned. So even if it's somebody who's like, I went to a party and I just decided to do it, it was like, I rarely do it. They're very much at risk. And if they don't see themselves in this and they're not taking the precautions, we're seeing needless loss of lives. So how do we make sure that we hold everybody? Yeah, thanks, Kim. You're so fantastic. Way more prepared than I am. Thanks, Kim. She's putting all the amazing links in the chat.
Shameless plug for any of you who are on Mentor City, the Who You Gonna Call team contact list has this email address, and also like the OAT initiative email, mental health and wellness email. And if you aren't, I think I see a few people on here who might be health staff or supporting health in community, but not a health director. I'll put the FNHDA email in here too, and please feel free to email me and I'd be happy to share that out too. I'm all about sharing.
Jodie, we have a huge concern as well as in our community about our members racing to the nearest liquor store every day. And I'm wondering if that's part of the harm reduction as well.
Oh, such a fantastic question. Not have enough time to go deep into that. I mean, yes. Ultimately, when we're talking about harm reduction, we should be looking at it all. Like, alcohol use, sex, safe sex, like all of it should be all intertwined, because the idea is that like we actually just want to really keep people alive and reduce the harms from whatever it is that's impacting them at this moment in time. Now, does this particular program focus on that? The answer is no, but it doesn't mean that if it's brought into the conversation and it's part of a greater scheme, we couldn't bring in the people that could help with those conversations, right? Because again, we're trying to break down the silos. And so like, I would totally encourage that if you're having a conversation around all the different pieces of this, because we know that sometimes people drink and then decide to use drugs, and they only use drugs when they're drinking, and then they're not making great decisions. And, all of those things, like we know they're all connected. So I encourage you to bring it into the conversation. Would this particular program be able to do that? Likely not, but we bring in the people that.
Yeah, because it just kind of involves like a whole bunch of other departments and programs and people, and then it adds on to the climate change and our different seasons. Like now it's winter and we're afraid that people are going to be using and it's freezing outside, and you know, it just goes on and on and on and on, and then you know, it's affecting so many people in our community as well, and I don't even know where to start sometimes. I just have to ask those questions sometimes to see if there's any support there.
Yeah, I totally encourage that. And you're right. The worst part is that this isn't a straight line. So there is no place to start. There isn't a very clear start here, progress to here, finish here. Like there isn't. That's not how this works. There is no clear. So start where you start and go where you go and go in all the directions. There are things called managed alcohol programs that could support in times, especially if you're in one of the communities where if there's an emergency, or if the roads close because of snowstorm, and then you have people in your community who could be medically at risk of detoxing and withdrawal from alcohol. Like, how are you set up to support those people so that there's not an increased medical risk if they can't get the alcohol that they need? And pieces like that, like very interesting conversation. See, this is the geek in me. I do this. I'm like, ooh. Yeah. How's everybody doing? Your cameras are off. I'm picturing a lot of like thumbs up and big smiles. Yeah, there we go. Like Rhonda.
I am doing really well. Yeah, I want to, I guess, because we haven't had anybody do the harm reduction since the first team had kind of is no longer here. So we don't have those, we don't have anybody out and about connecting with our community members, which is kind of sad, knowing that I'm sure they're getting some sort of supports, but at least they had somebody to talk to and reaching out and showing, you know, Yale cares. We do still care. We just don't have anybody out on those parts. And I hope that changes soon. But I do thank you for this, and I look forward to trying to find a way to implement this into our work, and hopefully we find someone to help take care of these things too. Thank you so much, Jodie.
Thank you, Rhonda. You totally reminded me of this whole like piece I didn't even touch on around when our neighboring communities don't provide the services we need support either. So there are some municipalities across the province that are very harm reduction against. That's my French showing, that are very against harm reduction. And so like our families and our community members can't even access the services they need close to them because the municipality or the services aren't there either. So like how that increases the danger and the harm done is even more significant, because then there's stigma and then there's barriers just to people accessing. So yes, there's a huge piece that needs to be done, especially around municipalities and their policies preventing the services that we need, especially for our family members and community members who don't live at home and are staying in those municipalities because they're closer to things that they need. And again, it's a much larger conversation, but really real. Thank you, Ron. I appreciate that.
Do we have any more questions from anyone in our virtual land? No? Okay, I think we can stop recording now, Kimberly.